Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: how long does Percocet stay in your system? Percocet is a powerful medication containing the opioid oxycodone and acetaminophen, the active ingredient in Tylenol. It is commonly prescribed to relieve moderate to severe pain as prescribed by medical professionals around the globe. From back pain to abdominal pressure, it is often used to ease chronic pain in patients. In this topic, we explore the duration of its effects on your system, including blood and urine. Understanding how this drug works can be essential whether you're a patient or caregiver. Wondering how long Percocet stays in your system? Most drug tests don't specifically look for Percocet, but they do test for opioids like oxycodone. Tests like urine and saliva can detect the drug for up to 2 days after use, while blood tests may only detect it for up to 24 hours. Hair follicle tests can even reveal traces of the drug up to 3 months later. So, if you're anticipating a drug test, it's best to avoid Percocet for at least a few days prior. Percocet half-life. Percocet's half-life is approximately 3.5 hours in the human body. This means it takes around 3.5 hours for half of the drug to be eliminated. Therefore, depending on the dose and frequency of intake, how long does Percocet stay in your system or how long does Percocet stay in your urine can vary. Percocet withdrawal symptoms. Dangers. If Percocet is mainly taken for long periods, the body and brain can grow dependent on this drug. As a result, when a person stops taking the drug, the body needs time to recover. This causes withdrawal symptoms. Withdrawal from Percocet can happen when long-term use is stopped or cut back. It can be hard living with Percocet addiction. Coping with such an addiction can be life-consuming. Also, those who are addicted can lose themselves to constantly seeking their drug, doctor shopping, and living in fear. How long does Percocet stay in your system under frequent and heavy use? Percocet contains both oxycodone and acetaminophen, which is why it is essential to recognize both of these components when understanding how Percocet is eliminated from the body. Generally speaking, most oxycodone is eliminated from the body within 8 to 36 hours. However, acetaminophen can take approximately 3 to 4 days to be eliminated from the body. Under frequent use, Percocet can stay in your system for 4 to 10 days. Regular use of Percocet can be hazardous, and it can be challenging to stop taking the drug once you start. Speaking to a doctor or healthcare professional about your Percocet use is essential to ensure you take the drug safely. Percocet abuse. Risks, dangers, and safety concerns. Percocet is classified as a Schedule II drug by the DEA due to its high likelihood of abuse and the potential for severe physical or psychological dependency. The increase in the misuse of prescription opioids has prompted governments to restrict access to these medications. One of the dangers of this drug is that it can cause tolerance to build rapidly, leading to addiction and other detrimental health effects. Prescription drug abuse is rising, and the risks of using Percocet are greater than once believed. Although easily accessible, many believe these drugs are safe to use. However, taking Percocet outside of proper medical treatment can result in serious health problems. Abusing Percocet results in a flood of dopamine to the brain, causing feelings of happiness, euphoria, and well-being, making one susceptible to addiction. Even with a short period of use, one may encounter difficulties stopping Percocet due to a return of pain or a physical tolerance requiring higher doses for the same effect. A potentially life-threatening overdose is a significant risk, especially if combined with other drugs or alcohol. If you are taking other opioids or a combination of medications, in that case, a doctor will not prescribe Percocet, and it is crucial to seek medical advice if you have safety concerns regarding your medication routine. Ensure you know the hazards before engaging in any behavior that could increase your chances of abuse or addiction. How long does it take to detox from Percocet? Someone taking a drug test might wonder, how long does a Percocet stay in your system? Percocet can still be found in urine for up to 3 days following the most recent use. Even after most of the drug has left the body, some still appear in the urine. Urine tests are meant to find trace quantities. Regardless of how long Percocet stays in your system, opioid abuse can result in long-term damage to the body. The development of drug tolerance puts users at a heightened risk of overdose and other complications. Before attempting to quit using Percocet or any other opioid addiction, A person should speak with a doctor because withdrawal symptoms can be excruciatingly uncomfortable, and cravings can be intense. To reduce these side effects, addiction treatment facilities may gradually wean a client off the medicine or substitute an opioid dependence therapy drug. Liver failure, heart attack, colon cancer, coma, death. Can you overdose on Percocet? A person can overdose on Percocet if the drug is taken more often than prescribed, crushed or chewed tablets, or combined with other drugs, such as alcohol or sleeping pills. Overdose is considered a medical emergency. Without prompt treatment, serious health effects and even death can occur. An overdose of oxycodone or acetaminophen, both in Percocet, could cause death if the mother took Percocet while pregnant. Oxycodone withdrawal symptoms in the newborn could be fatal. In addition, deadly Percocet side effects can occur if a person uses Percocet with alcohol or other drugs that cause drowsiness. As a concerned loved one to someone who abuses Percocet, stop worrying about, how long does Percocet stay in your system? How long do Percocet stay in your system? Start getting the help your loved one needs to put this substance abuse in the past. Signs of a Percocet overdose include vomiting, nausea, bluish nails and lips, severe drowsiness, unconsciousness, slow heart rate, extremely weak or stopped respiration, dangerously low blood pressure, coma, non-responsiveness, seizures. Percocet withdrawal symptoms include yawning, watery eyes, runny nose, restlessness, irritability, anxiety and depression, tremors, nausea and vomiting, diarrhea, hypertension, increased heart rate, muscle aches. Percocet withdrawal timeline. You might be thinking about getting clean from a Percocet addiction. If so, you might wonder why. How long does a Percocet stay in your system? Or you may be feeling very concerned about going through withdrawal. How long does Percocet withdrawal last? Percocet withdrawal symptoms can begin as soon as 4 hours after you take your last dose. These signs may take longer to appear if you have been using Percocet for a long time. Most people's withdrawal from Percocet lasts at least a week. Withdrawal symptoms could last up to 3 or 4 weeks for chronic users. The severity of Percocet withdrawal symptoms, how quickly they begin, and how long it takes to stop the withdrawal will vary depending on several factors. How long you've used Percocet. How much of the drug were you taking? How you consumed the drug. If you are abusing more than one drug at a time. Percocet Detox. Many drug tests have been developed to identify how long does Percocet stay in your system. Employers or addiction treatment facilities may utilize these to see a relapse in motion. Home detox can be dangerous because of complications that destabilize physical and psychiatric conditions quickly and severely. Abrupt discontinuation has caused seizures, convulsions, and coma. Additionally, usual Percocet addiction symptoms are exceedingly uncomfortable, and withdrawal is often self-medicated by resuming use. Without adequate medical supervision, acute withdrawal symptoms may continue for some days and result in the following: malnourishment, severe dehydration, extended hypertensive crisis. Medical assistance is recommended for Percocet withdrawal due to physical and psychiatric health risks. The most common medical method is gradually lowering, tapering, the usual dose as medications ease withdrawal symptoms. This process can last up to 2 weeks, depending upon one's health, the amount of Percocet used, and how long it was used. Now that we've answered the question, how long does Percocet stay in your system? Do not try detoxing alone. The detox process can be painful and difficult without medical assistance. However, getting through the detox process is crucial for continued treatment. We Level Up provide proper care with round-the-clock medical staff to assist your recovery medically. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.